The management of cancer, treating the underlying problems of cancer. The management of cancer is a complex problem. I have been using equipment for some time that is able to decipher if there is a metabolic impairment. Just as type 2 diabetes, there is not just a problem with sugar but a problem with metabolizing all carbohydrates and fats. I view cancer as a problem of metabolic imbalances. The management of cancer offers us an opportunity to focus on the metabolic origin of cancer and even the prevention. Just as an example, the changes and availability of glucose and glutamine target both tumor cells and the microenvironment of cancer cells. Studies show that the reduction of extra calories reduces the growth and progression of numerous cancer cell types including breast, brain, colon, lung, pancreas, prostate, and others. Restricting total calories lowers circulating glucose levels, which many tumors depend on for growth and survival. By increasing exercise, the glucose levels will also go down. Exercise and caloric restriction also creates a whole cascade that reduces accumulation of fat, a process of insulin resistance, leading to inflammation and damage to cells. I am also convinced that this whole process of better diet and exercise reduces the amount of hypoxia and acidosis to the tumor microenvironment. All those that treat cancer need to know about balancing dietary energy and dietary intake, so that there is adequate nutrition, yet reduction in the glucose that is available for cells to transform. By learning about the ketogenic diet and new ways to monitor the effectiveness of ketogenic diet, we plan to offer the patients and physicians better ways to monitor and manage cancer. For some people this will be a ketogenic diet, others have different needs. We plan to test and recommend dietary and exercise plans. This will also be an important up for prevention of cancer and diabetes. Everyone is at risk for cancer sometime in their lifetime. Everyone is also, may have cancers that do not progress and stay dormant for 10, 20, or 30 years. We are working on ways to do breath testing to see how people's activity measured against their caloric intake, measured against the kind of calories that people intake to see how their acetone levels are, and other important markers of metabolism. We are experimenting around with breath testing, saliva tests, and drops of blood. Ultimately, we want to make this equipment available to patients and their doctors for better monitoring of their metabolic state. This all leads to a better management of cancer. Besides balancing out metabolism better, early on in the 70s, when I did inflammation test with cancer, diabetes, heart disease, autoimmune disease, I realized the link between these diseases. Taking this 40 years later, I now realized that we can do tests that will help people prevent other diseases from occurring where better managed other diseases as well. There is a delicate balance in nutrition to have a reduced calorie diet measured against adequate nutrition and adequate exercise. It is an important balance to sugar levels that are too low, especially in those people who are predisposed to hypoglycemia. It is important to get enough nutrients without causing malnutrition or too much weight loss that reflects poor nutrition. Dietary restriction improves health, prevents cancer from advancing and reduces inflammation. In addition, this is the way to reduce tumor growth they can be used without adverse effects to complement conventional cancer therapy. Even fasting and calorie reduction can reduce some of the toxic effects of chemotherapy. Some studies show that tumor metabolism and growth can be effective from restriction of certain amino acids, such as research from the Gary Meadows Laboratory.